Hi, this is Joanne with your mini lesson on evaluating kidney disease using the glomerular filtration rate, also known as the GFR. After this lesson, you will understand what the GFR is and why it is important in caring for patients with kidney disease. You will also have a general understanding of how to calculate the GFR. As nurses caring for patients of any age with medical conditions, the importance of healthy kidney function cannot be overstated. There are many kidney diseases that can affect children and adults. There are also many medications that we give that carry a risk of damaging kidneys. There are trauma patients and septic patients that can suffer from kidney damage due to impaired perfusion. Measuring kidney function is routinely done through the BUN and creatinine in the blood. However, according to the National Kidney Foundation, the best way to calculate kidney function is to look at the GFR. It allows us to track the progression of the kidney disease, helping us to decide when it's time to change the plan, add a medication, or even start dialysis. So what is the GFR? The GFR is defined by Carol Matson-Porth in Essentials of Pathophysiology from 2011. It is the measurement of creatinine clearance by the kidneys. Creatinine is the waste product of muscle metabolism. Creatinine is normally filtered by the 1 to 2 million glomeruli located in the nephron of the kidneys. Let's look at the kidney diagram to see how the GFR is calculated. So, the blood travels from the aorta through the renal artery into the kidney, into the nephron, where the glomeruli are located. The glomeruli are represented by the red dots. The blood is filtered in the glomeruli. The creatinine is removed and excreted into the urine and travels down the ureter outside the body. The filtered blood then flows through the renal vein out to the body. So, to measure the GFR, the physicians use a fairly sophisticated formula with the components as listed: the urine concentration, the urine volume excreted, and the plasma concentration of the creatinine are used in a calculation to come up with the creatinine clearance rate, which is the GFR. So for nurses and others who would like to do an estimate of the GFR using some factors related to their patient, you can find these tools on several different websites. I used the one, MDRD was a research study in 2009 that developed this calculator that's widely accepted. And I plugged in the age of my patient was 50. She is a female and she is African American. Her latest serum creatinine was 1.5. We know that that's elevated. A normal creatinine is 0.6 to 1.2. When I plugged in that information, it gave me a GFR of 46.3, which tells me that her kidney disease is at level 3. So stage 3 kidney disease is represented by 46.3 GFR. So that is the overview of GFR, what it's used for, why it's important, and how it helps us to take care of our patients with kidney disease. Thank you for listening.